Good day. Welcome to Clinical Examination Skills. Today we're going to be looking at some special tests performed for different injuries. One of the injuries we want to look at today is the anterior draw test performed for ankle injuries. The purpose of this test is to check for anterior talofibular ligament injury and or ligamentous instability. The patient is supine with the foot relaxed, and the therapist stabilizes the tibia and fibula with one hand. Notice how the patient's foot is plantarflex at roughly 20 degrees. The therapist holds the patient's calcaneus with the other hand and distracts it from the tibia and fibula. The therapist places an anteriorly directed pressure on the calcaneus and talus, applying pressure at the end of the passive range. Notice the position of the therapist's hands. Here we can see the therapist performing the test in full. A positive sign will be ligamentous laxity or rupture or an excessive anterior translation of the talus. There may also be a presence of a sulcus or a dimple appearing over the area of the anterior talofibular ligament on anterior translation. But this test will only be performed if there is no pain. The next test we want to look at is the Apley's distraction test. This is performed for knee injuries. The purpose of this test is to check the integrity of the collateral knee ligament. The patient is prone with the affected knee flexed at 90 degrees, and the therapist places his own knee on the patient's posterior thigh to stabilize it. The therapist then grasps the patient's leg proximal to the ankle. The therapist will apply traction to the tibia towards the ceiling. Then he'd apply internal and external rotation of the tibia while tractioning. Notice the internal and external rotation of the tibia while tractioning. A positive test will result in pain on the medial side, which indicates medial collateral ligament damage, or pain on the lateral side, which indicates lateral collateral ligament damage. The next test we want to look at is the Eli's test, which is performed for hip injury. And the purpose of this test is to assess the rectus femoris spasticity, tightness, contracture, or shortness. The patient is placed prone, and the therapist will flex the patient's affected knee trying to bring the heel up to the glutes. Make sure that the affected leg does not abduct. A positive test will show that the pelvis on the affected side flexes as you try to get the heel to touch the glute. Thank you very much for watching. Join us next time when we present to you some other fun information.